India is world famous for its doctors and nurses, and it produces some of the world's best. We export a significant chunk of them to US and European countries. There are more medical colleges and teaching hospitals in India than anywhere else globally. But why are medical personnel being abused, bullied, manhandled, and even killed by the patient's relatives and friends in India? Globally, there were 1,200 attacks on healthcare professionals last year, and one-third of them were related to COVID-19. Unfortunately, India has the highest number, 412 incidents, carried out by protesters, patients, and their relatives, and even police. Now, let us look at India's reality through statistics. Recent reports documented that the country has a doctor population ratio of 1 is to 1,800, which is way too much more than what WHO norms recommends, that is 1 is to 1,000. That means a single doctor in India has to treat 800 more patients than required. The average medical officer posted in the outpatient department sees close to 350 patients a day. So naturally, what happens? The attention, care, and quality treatment go lower. The patient perceives this as neglect and ignorance from medical professionals. So, who is responsible here? The overworking medical professionals or the less attended patients? Our health sector still receives less than 1% of its GDP to meet its expenses. So, how do you think this will help in providing quality treatment to almost 1.3 billion people in this country? Instead of improving the public health sector, the governments have been trying to put public health responsibility on the shoulders of the medical professionals. For these reasons, we can see a number of medical professionals opting to go abroad to continue their profession, and this further deepens the crisis. But there are still professionals who opt to work in rural hospitals in India, skipping their opportunities to go abroad. So, is this how we respond to their choice? And rarely does mainstream take up the issue of mob attacks at health personnel. Poor quality of emergency care, poor pre-hospital emergency care like the paramedics, lack of intake capacity, high workload of government hospitals, lack of emergency resources like blood, laboratory services, and even drugs. These are some of the factors that cause unhappiness among patients and their relatives. And this ends up in violence to healthcare workers in India. These kind of issues are not confined to India alone. China, Nepal, Sri Lanka, Pakistan reports similar attacks on healthcare professionals, the people that bear the brunt of mob attacks. Is this what we give them in return for their service amid all these limited resources? There were instances when hospitals endorsed fraudulent activities, but the public has no right to take law into their hands. What if we make a mistake of attacking an innocent personnel caught up in a mob attack? Isn't it equally unjustifiable? So, how do we solve this? On one side, we have the Epidemic Act and the security forces to control such incidents. But does that solve the issue? No. These are simple control measures, and these measures may intimidate the emotionally drained relatives who already have suffered loss of their loved ones. What we need is a constructive solution rather than a destructive one. Prevention is better than cure, isn't it? So, how do we prevent these incidents? We need to improve the health infrastructure of this country in proportion to the demands of our massive population. Who are to bring these developments? The government, the representatives we elect. So, it's our responsibility, the voters' responsibility, the citizens' responsibility to hold our elected representatives responsible if we do not receive what we deserve. Good health is our right. So better healthcare infrastructure also becomes our right. And for our healthcare professionals, what do we do? What do we need? Trust. We trust a driver when we travel in a public transport, be it a bus, a locomotive, or an aircraft. We trust an unknown chef when we eat at a restaurant. And we ought to trust these healthcare professionals, not to portray them as gods or angels, but for them to work productively for us. They need to feel secure in their environment, and we, the public, need to cooperate.